I've been tracking the data out of Providence and looking at our Bristol County communities, and I saw that based on the state statistics that come out once a week, there was about a 52% increase to 881 cases week over week in New Bedford. So I just wanted to talk with you. Were you surprised? Are you surprised by the growth you're seeing in the city, and what might be contributing to it?
So, we are, I think, fair to say, compared to a lot of other places, at a lower point, but a more positive trajectory right now. Our new cases are going up faster. And as we look, we track these things every day. And one of the things that we look at is the 7-day rolling average of new cases, right? So you see blips up and down every day, but the 7-day average gives you a sense of trajectory. And we've been going up. So although the per capita number of cases are fewer here, we are still going up, although I think it's flattening a little bit. We're not going down, unlike Rhode Island, unlike the entire state of Massachusetts. And there are lots of reasons for it. There's, I think, a number of good reasons for the lower number overall, which is per capita, and that's because we got out ahead of it pretty fast, and we focused on nursing homes and long-term care centers right away. We buttoned things up pretty quickly. But, eventually some of our vulnerabilities would come home to roost. I think that's what's happening now. And specifically what I mean is that, we still have very much here in Greater New Bedford a traditional industrial economy. We have, a big part of our workforce is in manufacturing. We're not only the biggest fishing port in America, but we're also the biggest seafood processing center in the country. And so, and many of those businesses in those sectors were deemed essential. And so people have been going to work all along in places where sometimes social distancing is hard, and where remote work is not realistic at all. So, so what we've seen is in some of those sectors, we've seen increased numbers of cases for sure. We've taken a number of really direct steps to deal with that, to effectively direct social distancing measures in those workplaces, and I think that will make progress over time. The other thing that's going on right now too, Eli, is that that there has been an increase in a loosening of testing criteria in a number of places. Many asymptomatic folks are getting tested now, including at nursing homes, over at our hospitals, who are testing not just symptomatic folks, but a lot of asymptomatic folks. And then there's been some targeted testing, including at some of the workplaces I mentioned. So that's bound to increase the number of cases.
Are there specific neighborhoods that are hurting worse than others? Or when I say hurt, I mean that you're finding a larger percentage of cases than others?
Yeah, we plot the hot spots geographically, and they are what you'd expect. I mean, they are in the older tenement neighborhoods. You'd expect them to be hot spots just by virtue of their density anyway, right? So, but there are also lots of folks in those neighborhoods who work in larger workplaces, and therefore would have a higher chance of getting a disease in the workplace. But by and large, some of it's inevitable. I think what we can do best in the long run is make sure that the kinds of restrictions that we have in place in the large workplaces are faithfully enforced, and that's what we've been doing, and that's what we'll be doing for the foreseeable future. I note that the state has hinted at doing something similar in workplaces when the governor makes his reopening announcements, starting in the next few days and leading up to Monday. And it sounds like those might be advisory or not mandatory. We're going to continue to make them mandatory here, regardless of what the state does. I think that's just the right approach for New Bedford.
So, have you been generally supportive of that reopening phase plan that they're talking about at the state level, or are you saying it maybe doesn't go far enough for what you're seeing on the ground in New Bedford?
Yeah, there's not enough detail yet. To the extent that there's been any hinting of exactly what it will look like, I think there's been some signaling from the Baker administration that workplace safety rules may be and may be enforced only on a complaint basis, or that they may be suggestions rather than mandates. I think we will have in New Bedford something stricter than what that suggests.
Thinking about the future, and obviously this public health crisis has created an enormous headache from an economic point of view. New Bedford, thinking about the progress that you've made in recent years, what's it going to take to sort of move the city back into a positive direction, especially as this disease lingers?
Yeah, it's a big concern, Eli. Look, we don't, I've been saying for years that, cities that are not part of major metros, that are their own bottom, right, their own, metro areas, but they are, they don't have the major institutions that the big cities are very vulnerable in our modern economy. And I think that the coronavirus experience, the pandemic that we're in, will actually expand the gulf between cities like mine and major metros like Greater Boston and New York and a number of others. And so, it really, I think it should be, and I will certainly sound this alarm, it should be a wake-up call for state governments and the federal government to really start to invest in transformative places, in transformative opportunities in cities like mine, whether it's investing in key infrastructure, and we've got a long wish list of infrastructure asked, but also in building anchor institutions in cities like mine as well. It's going to require a lot of investment and a lot of hard work over time. And our city, doesn't have as diverse of an economy as a lot of other places. It doesn't, it has a workforce that is not as resilient because it doesn't have, we don't have the same level of educational attainment as a workforce as other places. And so, we're going to have to work harder, right away. I mean, we can't wait for the pandemic to end to start this work, and we're already doing that planning now.
And just finally, do you any message you want to get out to people who might be viewing this, people living in New Bedford, but also in surrounding communities that are, curious as to what's up in the city?
Yeah, I think what I say to folks is this. There's this is hard stuff. I think a lot of us thought that pandemics have been relegated, to the pages of history, but here it is. We're actually living through one in our own lifetime, and sometimes it feels like a movie. But putting that, the surreality of it aside, there are a lot of people are hurting, and everybody's paying a price in some way, some more than others. There have been people who've been sick, people have lost jobs, and some have lost lives. And so, we have to understand that there's been real hardship for one thing. Despite that hardship, the thing that is the most heartening, the most encouraging is that people have been, and certainly in Greater New Bedford, have been supporting one another. They've been complying with social distancing mandates. They've been very understanding. They've been very grounded in the way they've adjusted. And so we just have to keep that up for a while, because the reality is that even after things start to reopen, the virus will still be around. People will still be susceptible to catching it, and we have to continue to keep our focus.